Hello, and thank you for the kind invitation to speak at the 34th Seoul Physical Therapy Conference on the topic of physical therapy in obstetrics and pelvic health. I'm Rebecca Stephenson, past president of the International Organization of Pelvic and Women's Health Physical Therapy. I'm excited to bring our 5-person specialized physical therapy team to Seoul to discuss women's and pelvic health physical therapy. Let me introduce the presenters and say a bit about what they will be speaking on at the March 26th conference. I myself have worked in women's and pelvic health for over 35 years, and I'm a board-certified specialist in women's health physical therapy. I also have my pelvic CAP certification, and I work in an outpatient clinic seeing patients of all genders and teach at local universities and for the Academy of Pelvic Health, both nationally and internationally. My topic at the conference will be discussing the history and journey of global women's and pelvic health and the influence internationally on the field of women's health in physical therapy. Joy Hung Young has her PhD and is a board-certified specialist in women's health physical therapy. She works in an outpatient clinic treating people with pelvic and women's health conditions. She will discuss why we need pelvic health physical therapy in South Korea now. She will provide statistics, prevalence, the current practice of obstetric and pelvic health physical therapy, and her own journey of pelvic and women's health physical therapy. Lori Mize is a board-certified specialist in women's health, and Lori is an academician and teaches at the University of Central Arkansas. In addition, she teaches for the Academy of Pelvic Health and teaches in the United States and internationally. Her topic will be to define the scope of practice of women's and pelvic health physical therapy, what are the international standards, and how we function in the multidisciplinary health team. Karen Snowden, our 4th presenter, has been working in obstetrics and pelvic health for 25 years. She's a board-certified specialist in women's health physical therapy and has her CAP OB and CAP pelvic certification. She works in an outpatient facility and treats patients of all genders, and she also teaches in a university and with the Academy of Pelvic Health, teaching both obstetrics and pelvic health. Additionally, she has a course in menopause education. Karen will be discussing a case of a pregnant woman who receives physical therapy for back pain, is educated in preparation for labor and delivery, and then is seen again postpartum for strengthening so she can return to an active, pain-free lifestyle. The last of our speakers is Carrie Melby, who has a master's in physical therapy and has been practicing for 20 years, the majority of which has been in pelvic health and obstetrical care. She has over 15 years' experience in growth and development of pelvic health programming involving both operational and mentorship initiatives. Carrie presents to numerous healthcare professionals in various settings, both medical residency programs, national conferences, universities, and as an adjunct faculty for local physical therapy programs. She is also on the faculty for the Academy of Pelvic Health and teaches both nationally and internationally. Carrie will present a case discussing pelvic organ prolapse and stress urinary incontinence. This will include the patient presentation, examination findings, and intervention strategies from the start to the middle and to the end of care with medical interdisciplinary needs and outcomes. Then to round out the session, we will have a panel discussion and take any questions that you may have on the presentations or any other considerations that you have for women's and pelvic health in South Korea. I look forward to seeing you in Seoul. Thank you.